Stress fractures in athletes and people participating in exercise is rather common. And with a stress fracture, there's no specific injury or trauma, rather it is a repetitive overuse that leads to this type of injury. There are several risk factors that can lead to this bone stress injury, but in this video I'm going to focus on one of them, and that is the risk of over-specializing in one specific sport such as running and not participating in a diverse set of exercise can pose a risk factor. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon in New York, specializing in sports medicine and arthroscopic surgery. When we repetitively overload our bone, like running and jumping, this creates little stress and micro trauma in the bone. And the body responds by repairing it, remodeling it, and these changes help make the bone stronger. Now, the problem occurs is if the rate or the amount of stress that we are performing on the bone outpaces the body's ability to repair and remodel, then we end up with a bone stress injury. For example, take a situation where someone, let's say, starts training for a marathon, and they've quickly increased their amount of training that they do, their distance, their speed, those type of things. So now their bone is seeing a lot more repetitive overload, and the bone can't keep up with it. Sometimes we'll see in that situation a stress reaction injury occur. One helpful way of thinking about a stress fracture or stress injury, imagine if you had a pipe. It would be hard to break it. But if you took that pipe and you gently kept, stressing and stressing and stressing it, eventually little micro cracks are going to occur. And in our body can respond by repairing it, but if we keep doing it too much or too quickly, then a real crack is going to form. As I stated in the beginning of this video, bone stress injuries are very common in athletes, and there's some studies that show that 10% to 20% of all overuse injuries are these bone stress injuries in runners. And the bones most commonly affected are the tibia, which is the shin bone, as well as some of the bones in the foot. There are several underlying risk factors that can push someone into developing a bone stress injury. Some of these may include osteoporosis or osteopenia, where patients have low bone mineral density. There are some people who have poor nutrition, and there are studies that show that if someone has low levels of calcium or vitamin D could be an issue. There were actually studies that showed that by giving military recruits calcium or vitamin D could even push down the risk of developing a bone stress injury by as much as 20%. And then finally, there are people that can have other medical conditions like hormone dysfunction, like thyroid dysfunction, or a problem with their gastrointestinal tract where they can't absorb nutrients well. So there are some other underlying medical conditions that can increase the risk of an athlete developing a stress fracture. And the risk factor that I want to focus on in this video is the risk of over-specialization in just running as one sport. And so studies have shown that those adolescents or younger people who participate in multidirectional sports, so you can think of that moving around, like basketball or soccer. So it's not just running in one specific way, but constantly moving around, reduces the risk of someone developing a bone stress injury. And some of the thoughts about why this may be is because if you're constantly moving around, different aspects of the bone will feel different stresses. So you're never overloading just one spot of the bone where it can't have time to repair and build itself up and remodel. So it's always staying below this threshold, so you never go past that point where you develop the stress injury. And this will make the bone stronger because you're always below that threshold. And now there have been studies that actually look to see, well, does this playing multidirectional sports as a younger person, does it actually translate into lower risk level of having a stress injury? And the answer is yes. So there was a study with about 1,000 military recruits, and they found that the ones who had participated in things like basketball or soccer had a significantly 50% reduced risk of developing a stress injury to their bone compared to those who were only runners. And similarly, there was a study in elite runners, about 270 elite runners, and they found that those who also participated in these multidirectional sports like soccer also had about a 50% reduced risk of developing a stress injury in the bone. Children and adolescents, as they're growing, their bones are growing as well. And so during this period of time, if they're playing multidirectional sports, will help improve their strength of their bones as they're growing. And some studies have shown a 10 to 20% increased strength in those young athletes who are participating in multidirectional sports. The treatment for most stress fractures is uncomplicated. Usually it's several weeks of relative rest, avoiding impact activities, no running, no jumping for several weeks, and as the patients recover, we slowly reintroduce them to the activity. However, there are a few stress fractures that we have to be a bit more cautious about, and those are ones around the hip and some of the bones in the foot. Let's wrap up this video and go over a few key points. Number one, multidirectional sports like soccer, basketball can improve bone health in adolescents. Number two, these multidirectional sports can decrease the risk of developing a bone stress injury. Number three, focusing and specializing in just running without other sports can increase the risk of developing a bone stress injury. Number four, there are some underlying risk factors that can increase the risk of developing a stress fracture. That could be things like poor bone density, poor nutrition, or underlying medical conditions. And finally, most stress fractures are uncomplicated and can be treated with some relative rest. Thank you for watching this video. If you found it helpful, please click the like button below and subscribe. Thank you again for watching. I look forward to seeing you in my next video or in my office.